Good afternoon, and actually our little glitch has actually been solved. So I've got Miss Kavals here actually, and so we're going to start. Not everybody's here. It is 59, so people will be joining us as we talk. But I'm going to share just two slides with you, 2 or 3 slides about the Oxbridge Network before I hand over to Miss Kaval. Okay, so I'm just going to do this very quickly, and I'm just going to share my screen. So there we go. Right, just moving on. Okay, so this is the Oxbridge Network, and it's a lecture series that we started last term. Our first lecture was actually a mathematics lecture by one of our teachers at Solihull. And our second lecture in the series is actually as entitled on the slide that you see, which is on medicines and metals. I'm just going to say something very briefly about the Oxbridge Network because there are a number of other events and other activities that we run for the whole of the network. And so just to advertise the next set of lectures that are happening, usual time 5 o'clock online, and we've got Mr. Rory Salt doing the next lecture on the 9th of March. And as you can see there, it's on a medieval prince, which will be very interesting. On the 11th of May, we've got Dr. Stuart Hart, who's doing, and there's a typo on Wolf there should be a double O, but Virginia Woolf and literary impression. And then we've got Chris Priestley doing a physics lecture on internal combustion engines. There will be some other lectures that are actually going to be slotted in. I've actually got a lecturer to talk to us about fractals in mathematics after half term, and so there will be a second date after half term, so that anybody who's interested in maths can actually avail themselves of that. And other Oxbridge Network activities and events, there is an Oxbridge Network Essay Prize. So if you don't know anything about it, then contact your Oxbridge coordinator. There are prizes, money prizes. There are 9 prizes of £50, and the deadline is summer half term. We have a trip going to Girton for the full network, and also we have an Oxbridge tutorial event which mimics tutorial events at Oxford and Cambridge, which are actually very useful for people. And so those are the events that are coming up, and there will be some others that we are running with Cambridge University, and the dates of those will actually be publicised for the summer term. Now, what I'm going to do is I'm going to stop sharing my screen, and I'm going to hand over to Miss Kavals to introduce herself. I am going to hand over the presentation of the of this event to her now, as long as I can find her here. And this is a rather cumbersome way of doing it, but this is what I've been told we need to do. So I'm going to hand over to you, and I'm going to make you the presenter now, so you can actually share your screen. So over to Miss Kavals to talk to us about medicine and metals. And thank you so much for volunteering to do this lecture. It looks as if it's going to be exceptionally interesting.
Thank you so much, Dr. Foster. Thank you for everyone who has attended, who's attending now. What I'll do then is I'm just going to get up this screen. So I'm going to share my screen with you. Let's have a look. How do I do this? Here we go. So like Dr. Foster said, my lecture today will be on metals and medicine. Can you guys see that first slide?
Yes, we can.
Yeah, fantastic. So I'm not sure, how do I present this? Present to view? Go. Should be fine. So I'm going to talk about metals and medicine today. Before I do that, what I'm going to do is I am going to actually, I'm just going to change it slightly. I'm just going to give you a bit of background to like myself, my background in science. So if you can't see at any point, please let me know. So just a background on me as a scientist. Before I became a teacher, I did work as a scientist for a little bit when I was at university. But before I even went to university, I did my A-levels, got A-levels in chemistry, biology, and French. When I was doing my A-levels, I think biology was the one that I quite enjoyed. French was a close second. Chemistry, actually, not until I got to year 13, it didn't become my favourite until then. But then in year 13, I absolutely fell in love with it. So much so that I ended up doing a degree in it. So I've got a master's degree in chemistry. I did 4 years. And so when an MSci is basically when you go to university, you don't graduate after your 3rd year. You carry on doing master's project in your 4th year and you graduate all at once. And the reason I'm just drawing attention to it is because, loads of you are looking at university in the future and there's different options. I know before I went to university, I always thought that you have to do your bachelor's first, then your master's afterwards, but there is an option to do it all at once. So that's my route. So I was at university 4 years. At University of Birmingham, absolutely loved it. When I was there, absolutely adored organic chemistry. That was in particular a field of interest for me. I think from the get-go I was always going to be an organic chemist. Particularly, I enjoyed the organometallic side. So I remember when I was in my 3rd year, I think 3rd or 4th year of university, I was part of a lecture series. So I took part in a module and it was delivered by Dr. Richard Granger at the University of Birmingham on organometallics, and absolutely blew me away. I thought it was just so fascinating, so interesting, all these reactions that you couldn't do previously, that if you put a metal in, you can do it, and absolutely fantastic. Now, during my final year at university, so like I said, I did a 4-year MSci. I completed an MSci project on synthesizing molecules of interest in the inhibition of Salmonella typhimurium, so S. typhi, efflux pumps. Loads and loads of words. To translate it into basic English, this is bacteria, we could assume this is Salmonella. And basically, these blue dots, they represent the antibiotic. And what happens is, during Salmonella, the antibiotic can come, it can, through passive diffusion, just enter through the cell membrane. However, what happens is that these pumps that span, I can only see 2 here, but they basically span the surface of the bacteria. And when the antibiotic basically gets into the cell, it's pumped straight back out again by these pumps. And what happens is, so research was carried on trying to mutate the Salmonella to try and, incapacitate these pumps. And it was successful. So what happened was these pumps, the mutation meant they could no longer work. However, when they subjected these pumps, when they exposed them to a mixture of chemicals, what happened was that these pumps, they started working again, and they couldn't figure out which chemical it was, and they couldn't separate the mixture. So my job was synthesizing these different molecules that had pretty much very, very similar structures, to try and see which one of those was really important in making the Salmonella pump resume working, even though we had mutated it. Now, I'm aware this has got nothing to do with metals and medicine, but it's just a little bit of my background in science. So before I became a teacher, so I did my master's, worked in a research lab for a bit, and then I went into teaching. It's my 3rd year now. But back to the lecture itself, so metals and medicine. And what I'm going to be doing with you today, just in general, talking about materials and their use in the use in healthcare, and then I'm going to be focusing a bit more on metals. Now, when do we use chemicals in medicine? Now, medicine, the field, you think it's very biology related. You're thinking about, like the body, anatomy of the body, interactions in the body. But in terms of, treating illnesses, things like that, chemicals, they are super important. Now, a medicinal drug, for the purpose of this lecture, I'm going to refer to a medicinal drug as, a drug that has an active role in treating or preventing an illness. Okay. Now you might think, Miss, what other types of drugs can you get? Well, you can actually get quite a lot that aren't actually actively involved in treating or preventing that illness. So another example is using chemicals for drug delivery. Now, the material that we use only ensures the safe delivery of that drug, and it doesn't actually treat the illness itself. An example of that, you may recognize this from GCSE days, is a carbon nanotube. So this is called a functionalized carbon nanotube. And what basically we've done is we've the outside of the carbon nanotube, we've added attached groups to it, and we've functionalized it. And what that carbon nanotube can do is it can act as a capsule. So there's been research actually in particular for breast cancer drugs, so that contain iron, that to get them to the site where they need, where the cancer is, they've been encapsulating them in these carbon nanotubes, and then once they enter the body, they can go to that particular site. However, the carbon nanotube itself doesn't actually treat the cancer. It's only a safe vessel to allow that drug to get to where it needs to be. Diagnostic imaging. So diagnostic imaging, chemicals regarding that, they give us information about particular parts of the body in preparation for treating an illness. So I'm thinking, when you've got x-rays, things like that, things, where does a drug molecule go? So things to do with diagnosing an illness and also trying to figure out where has that drug molecule gone. Okay, so think about imaging. And as well as that, medical implants, so devices that are placed inside the body to replace, support, or enhance existing body parts. Okay, so all of these are times where we would need to use chemicals in medicine. Now, give you loads of examples of when we would need to use chemicals, but how can we decide what materials can be used? So here we've got the periodic table. This is the AQA periodic table. I love using it because I really want to get my students used to using it. The one key thing that's missing about this periodic table, though, is that you've got the lanthanides and the actinides, which are underneath. So you've got two rows of elements. You've got the lanthanides first, the first row, then you've got the actinides directly underneath. And they've been omitted from this periodic table because they're not really, AQA won't talk about them. So they've basically just omitted that section, so they only really want to focus on this section here. But there are 118 known elements in the periodic table. And when we've got such a range, we need to think about, well, can we use all of them, or what properties of them make them suitable to be used in medical applications? Now, we need to consider certain factors when using these elements in healthcare, and which I'm going to go on to in the next slide. And I've just talked about elements to really simplify it. However, the same considerations apply when we're looking at compounds, mixtures, things like alloys. We've got to take into account certain considerations. We can't just use an alloy for the sake of using an alloy. It might fit one purpose. However, there might be other things that it might not fulfill in terms of the criteria. So when I think about criteria, let's think about the application. If I think about hip replacement versus a contact lens, they've got completely different applications. Therefore, they're going to have completely different properties that you need. So, titanium hip replacements, but you're not going to have a titanium contact lens, because they've got completely different applications there. So that's something really important that you need to be considering. Why are you wanting to use that chemical in the first place? Toxicity, really important. Yes, it could, for example, an anti-cancer drug, it could kill all the cancer cells, but is it also going to kill vast majority of your body cells as well? So that's something you need to be considering. Interactions with other drugs. One that I can think of off the top of my head is the contraceptive pill. So hormonal contraceptives. Often when you use antibiotics, they don't work. So think about, okay, if you're using chemicals in a drug, are they going to inhibit the use or inhibit the function of another drug that you're also taking alongside that chemical? Bioavailability. So this is basically what I mean by bioavailability is the rate and extent at which a drug molecule is absorbed in the body and it enters circulation. So basically, for a drug to work, it needs to actually be absorbed in the body. So that gives you information on how available that drug is to do its function. And cost. Now, I'm a scientist. I've put cost right at the bottom. If you're a manufacturer, you work in industry, had to make a profit, I think cost may be slightly higher up there, because that is a massive factor in determining, would a drug go to market? Would a company launch a drug into market? Can they make a feasible profit on it? Are they using chemicals that are really expensive? You can use gold for an application, but if you can use a cheaper metal, would you be using that instead? What would the trade-off be in terms of quality? So we've talked a bit about why we'd use particular chemicals, and I've been specific about elements there, but why would we use metals in medicine? Now, they do the job, and that's really important. You actually want a drug to do its job, and it is hard. Drug discovery process, it is really hard. I could do a whole lecture on drug discovery and the how we do that. We've got fragment-based drug discovery, things like that. But to cut it short, it is really hard to discover a drug, to get it past all the safety checks, past all the clinical trials, and actually have it to market. So they do the job. High biocompatibility. A lot of the time, the metals are used in medicine, and obviously, I'm talking about specific examples here because, equally there are some metals you definitely wouldn't use in medicine, but quite often metals, they do have high biocompatibility. They do work well in the body. Low toxicity, obviously, like I said, not all metals. You wouldn't use plutonium, that's radioactive, something like that. You wouldn't use all metals in medicine, but you may be using some of them because of their low toxicity. Strength, okay, is particularly if we think about implants, we think about the strength of medicine, strength of the metals. That's quite important. Resistant to corrosion, when we go through the reactivity series in GCSE, we talk about, how certain metals, they're more susceptible to corrosion, things like that. But, when we're thinking about using metals, especially in implants, we're talking about, they need to be resistant to corrosion. If they're in the body, they can't be corroding in the body, can they? And then metals, if I'm really zooming in on the key properties of metals, variable oxidation states. So, like it says on the tin, really, think the charges they can take. We can have copper plus, copper 2 plus, things like that. And the fact they've got variable oxidation states is really important in the application, especially in terms of medicinal drugs, which is what I'll be talking about with you today. And ability to bind ligands. Those from year 13 should have hopefully come across ligands. Those of you who are not year 13s are a bit younger. What I mean by ligand is basically a group that can attach to a metal center, metal ion center. Okay, so that's for the purpose of this. That's basically all you need to know. So I am a massive ancient history nerd as well. So I really, as much as I love chemistry, I always say if I didn't do chemistry at university, it would have been ancient history. So hopefully you'll see bits of that and pockets of that during this lecture. But in terms of using metals in medicine, yes, it is a very new field, but we have been doing it since ancient times. Now here we've got some hieroglyphics. This is actually the Ebers Papyrus, and basically it's an extensive record of ancient Egyptian medicine. It was around about 1550 BC. And it's a collection of different papyri. I think that's the plural for papyruses. But basically, it's a record of ancient Egyptian medicine, and it went through treatments they had back then and how they would treat particular ailments. Now, within the Ebers Papyrus, there is a mention of copper being used, and it's used to treat headaches. Now, if you think back to ancient times, they wouldn't really have much information about, the drug discovery process, analytical techniques, things like that, test to see how a drug would work. But, through trial and error, generally, I would say it was done back then. They found out copper was actually quite useful in treating headaches. Now, if we jump to modern day, modern studies actually suggest that migraines can be linked to poor copper and zinc balance in the body. I tried to look for a bit more information on this. Some studies are saying that you've got high copper can lead to it. Some studies are saying low copper levels. So I'm just going to say perhaps a poor balance would lead to migraines. Not all migraines, but certain migraines, can be linked back to that. There is a correlation. And as well as that, I mentioned the use of lead. Now, when I think lead, I don't think particularly medicine. The first thing that comes into my mind is pencil and toxic. But lead sulfide, naturally occurring in the mineral, is known as galena. It was used as coal and also to treat eye infections. Now here you've got the bust of Nefertiti. This is quite a famous, depiction of Nefertiti from the ancient times, ancient Egypt. And you can see her eyes, they've been lined with this black coal. And, it was quite commonplace, from what we can see from ancient Egypt to use it. And this is what was used, the lead sulfide. And they had the belief that, as well as using it for, aesthetic purposes, it would also treat eye infections. That's from the ancient times, they're already using metals in, for a healthcare purpose. Now, the theme of this talk, I've spoken a little bit about ancient times. I'm going to carry on speaking about it for the duration of this talk, but I'm going to focus and zoom in on 3 particular drugs. Now, I could talk about implants, I could talk about imaging, I could talk about drug delivery, and within their own fields, they are fantastic applications. I'm just going to zoom in a little bit. I just thought to myself, I could do quite a few varied, or I could in detail talk about a few. And in detail, I'm just going to talk about 3 medicinal drugs. So for the purpose of this talk, medicinal drug, a drug molecule that is used to treat an illness or prevent an illness. Now, I'm going to in particular be talking about silver nanoparticles, cisplatin. Cisplatin, you should have heard of cisplatin, hopefully, if you're doing A levels. And and oranophine. Okay, so oranophine used to treat arthritis. That's the three that I'm going to be talking about today. And if we talk about silver nanoparticles, I think it's really important to appreciate silver through the ages. So I've spoken a little bit about ancient history, ancient Egypt. Silver in healthcare also has, ancient roots. So this is Herodotus, and he was an ancient Greek historian. Now, quite a lot of people would refer to him as the father of history because a lot of his accounts are, credited to be the first accounts of history. Off the top of my head, I think he wrote about wars between the Persians and the ancient Greeks. But in one of his accounts, he mentions that Persian kings, they would refuse to drink water from vessels that were not made from silver. So if they were to drink water, it had to be from a vessel, similar to this one here, that had been made from silver. And, they linked it because of its antimicrobial properties. And, silver is recognized by its antimicrobial properties, not just by the Persians, but also by the Macedonians. And they would actually use silver as plates to heal wounds. So if they went to war, for example, and they had injuries, what they would do is they would put silver plates on their wounds, and they'd, thinking that it had antimicrobial properties, that they would actually think it's an effective way of treating that wound. Now this here is Avicenna, and he was around between 980 and 1037 AD, okay, so a little bit later. And he was a Persian philosopher and a scientist as well. And he was around in what is now known as modern-day Uzbekistan. And he also reported the use of silver filings in healthcare, and he said could be used as a blood purifier, a treatment for bad breath, and also heart palpitations. So he recorded that, silver filings, they've got a variety of different uses. However, he also reported that patients that used silver filings, they had like a bluish discoloration in the eyes. Okay, and this was known actually and credited as the first recording of argyria. Now, argyria, if we look here, there's loads of pictures on Google. Some of them are a little bit intense, so I picked this one. And basically, you can see around the eye, you've got this silver discoloration. Now, argyria, basically, it's when you've got accumulation of silver within the body. So silver is used in dressings, which I'm about to go through. It also can be used in ointments, to my knowledge. But if you accumulate it in your body, you can basically end up being silver. So, your skin goes like a silver, sheeny colour. You're welcome to Google it later. There are loads of images there of people that have unfortunately got argyria. Now, let's think now towards modern applications. And I'm going to be talking about silver nanoparticles in dressings in particular. Now, here I've got a diagram here. We've got a cotton fabric, and then these orange star-like materials, AGNPs, that are silver nanoparticles. Okay, and how we're doing is basically coating this material with the silver nanoparticles. Now, nanoparticles, think back to your GCSE knowledge, if you did triple science, between 1 to 100 nanometers big, okay? Now, what we have is, just noted error there, should be silver ions, put silver there instead. What we have is when we've got these silver nanoparticles, they release a large amount of silver ions, okay? Now, these silver ions, they're now soluble. This allows them to bind to bacteria cell membranes. If you think about the structure of a bacteria cell, the cell membrane, these silver ions, they bind to the cell membranes, and that distorts them, okay? And that is a way that, they can reduce, that's, how they work in terms of their antimicrobial properties. Now, as well as that, they can also denature RNA and DNA, which prevents replication. Now, this might not, necessarily kill them at the time, but if it's preventing replication, it's preventing from replicating, from reproducing. So, that is another way in terms of how silver has got those antimicrobial properties. Okay, so that's just a modern application. And here we've got Cutiderm. So this is an example of an adhesive silver dressing, where you've got those nanoparticles in there. And, like I said, throughout history, they have been accredited for having these antimicrobial properties. So that's a little bit about silver and how we use silver nowadays. I'm now going to talk about cisplatin. So this here is a cisplatin molecule, and it is the first FDA-approved cancer treatment that contained platinum. Okay, now prior to cisplatin, I remember being at university and hearing about it, and one of my lecturers would say, prior to cisplatin, the medical field was dominated by organic chemistry, and as much as it pains me to do a lecture on metals in medicine as an organic chemist, they have a massive role. They are super, super important, and cisplatin is such an example. Now, in particular, it's known for its ability to treat testicular cancer. And, you know, prior to cisplatin, testicular cancer was pretty much, I wouldn't say death sentence, but, you know, was quite severe. You know, the survival rates were very, very low. Now, after cisplatin was put into market and, you know, given as a drug molecule, testicular cancer survival rate increased by 2/3. Okay. So that's insane. It's a massive amount of people that were now surviving because of this drug. Now I'm aware that that is a bit, you know, 2/3, you know, you want me to look up the data. Here's the article that I took it from. As well as that, I'm sure Dr. Foster will send out slides. There are sources. I've tried to be really good with referencing information. When I was at university, I was brilliant at it. I'm a bit rusty now, but I've tried to reference as much as I can. If you want to have a bit more look at cisplatin there. Now, cisplatin, how was it discovered? Now, this is Dr. Barnett Rosenberg, and he was from Michigan State University. Now, it's actually quite interesting how cisplatin was discovered, you know, for its use, you know, its anti-cancer properties. What Dr. Barnett Rosenberg did, he actually carried out an electrolysis type experiment. Now, he wanted to put an electric current through E. coli to see if it would inhibit cell division, which means to stop the cell division. And as part of that, he used platinum electrodes. Now, his experiment was successful. He did actually manage to inhibit E. coli cell division, and, you know, it's fantastic that, you know, he's used that electric current and it has had, you know, a positive impact on his research. However, he assumed that it was the electric current that was doing the inhibition, and for 2 years he made that assumption, and he tried to figure out, well, why is this electric current, you know, inhibiting the cell division? And it actually turned out after 2 years, it wasn't the current that was stopping the cell division. It was actually the platinum compound that was released, and that was cisplatin. Now, here we've got cisplatin in terms of a molecule. Now, it's a square planar structure. You can see through the structure here, you've got 2 bonds coming out and you've got 2 going towards you. Now, in terms of platinum, it is platinum 2+. Now, we refer to that as a D8 metal. What that means is, in terms of metals, you know, the electrons, they are in orbitals. We think about electron shells, we're at GCSE, and then when we get to A level, we consider, you know, actually they're in orbitals. You've got the different shapes of orbitals, S, P, D, and F. It's a transition metal. It's called a D8 metal because we say that it's got 8 d electrons in the d orbitals. Okay, so those d orbitals, 8 electrons occupy that. Now, there is something special about metals that have 8 electrons in, or metal ions that have 8 electrons in their d orbitals, and that's the fact that they actually preferentially take square planar structures. So if you've got a d metal, the chances are it will take a square planar geometry, which is planar, and obviously you've got the 4 groups. Now, how does cisplatin actually work? And I've got a little diagram here to show you, you know, how does it work. You might have heard about it in your lessons, but you might not have got into detail, but, you know, this is cisplatin, it treats cancer, but how does it actually treat cancer? So here we've got our cisplatin molecule, okay, and what it does is through passive diffusion, it enters the cell. Now, when it enters the cell, it doesn't remain this structure here, okay? What happens is that these chloride ligands, they're replaced by water ligands. Okay, so we can see here, we've got the chloride ligands in our diagram being replaced by water ligands, okay, and it's releasing chloride ions. Now, once we've replaced those water ligands by chloride ligands, let's think about what happens. We've started off with a neutral species because chlorides, you know, Cl is Cl minus, you've got 2 Cl minuses there and a Pt2+, so overall it's going to be neutral. Once you've got 2 neutral ligands, though, let's think about it. All the ligands are neutral. So overall, if we've got every single ligand being neutral, our platinum 2+, that means overall our molecule is got a 2+ charge. Now, because it's got a 2+ charge, it cannot pass back out of the cell. Okay, that's charged. It can't pass through that bilayer, which means it actually stays in that the cell. Now, in terms of what happens, okay, we've got the water ligands, so you've got ligand substitution happening, you've got the chloride ligands being substituted by the water ligands, and it's a 2-step process, so you've got monoaquated and then diaquated. Now, once that happens, what we have here is a N7 adduct. Now, what that means is this is our DNA strand. The cisplatin, those water ligands then fall off. Okay, now at this point, the ammonia ligands haven't done anything. Okay, it's just these ligands the other side. First the chloride, now the water ligands, they fall off. Now you've got a substitution happening again. This is a strand of DNA. The G is for guanine. Those of you who are doing biology, obviously you should be aware that you've got the strands of DNA and you've got the base pairs. what happens is that platinum, it binds to the guanine, and it binds to actually the 7th nitrogen atom on the guanine, which is why we call it an N7 adduct. Now, when it does that, it disrupts the DNA structure, and we can see a little diagram here of how it does it. Now, most of the time, it's when you've got two guanine bases right next to each other. Okay, so 65% of the time, that's where it binds. About 25% of the time, it binds when they're when you've got a space in between. So not very often. Okay, much would rather prefer to bind when you've got two next to each other. And we would call these intrastrand adducts. Now, as you can see, it's binding to the same strand of DNA. Okay, DNA is a two-stranded molecule, but it's binding to the same strand. Now, as well as that, you've got an interstrand adduct. Interstrand crosslink. Now, what that is, if we look carefully at this diagram, yes, you've got the platinum attaching itself to two guanines, okay, that are acting as the ligands. However, they're not on the same strand. In terms of how it's been folded, they can be quite close to each other in space, but they're not on the same strand, and we call that interstrand crosslink. And how it works is basically it disrupts that DNA, okay, and if you're disrupting the DNA, it's going to lead to, issues in replication, things like that. So that is how cisplatin works. Now, that is cisplatin itself. And as we can see here, the fact that they are adjacent to each other is really important when we think about the binding. And that is why transplatin will not work. If you think about it, you're not doing anything to these ammonia ligands. Okay, it's only the chloride ligands that are first being replaced by, you've got ligand substitution, so being replaced by water ligands, and then being replaced by the N7 on guanine. Now, because you've got, if it's trans, this geometry here, they can't form those adducts, they can't form. So if we look here, they can't form the adducts, they can't form the crosslinks, because, if you've got another Cl there, that's another binding site, but it can't bind there in terms of geometry. That is why cisplatin is actually the only molecule that is active. Now, other analogues, so since cisplatin was developed, it's been so good at its job and so popular that other companies have been looking at, well, how can we, replicate this? Can we think about other platinum-containing drugs? And I've got some here. So that's cisplatin there. That's the first one. As well as that, we've got carboplatin and we've got oxaliplatin. Now, carboplatin, it is used in conjunction with other drugs. It's fairly successful. However, it's not as successful as cisplatin. And I think the reason for that being cisplatin is just stronger. People have reported that they've done studies on it. Carboplatin, when it's used, it leads to less severe side effects because anti-cancer drugs, they do have severe side effects due to their nature, of killing cells. But cisplatin is just more effective, even though it has got stronger side effects. And the final metal that I'm going to talk about this evening with you is gold. Okay, so we've talked a little bit about silver nanoparticles and how they work. We've talked about cisplatin, platinum-containing drugs, and we're just going to spend a little bit of time talking about gold. Now, a bit more ancient history for you. Gold in the ancient times. Now, the chemical symbol for gold is Au, and that originates from the Latin word aurum, which means gold. And there's also links to, in ancient Greek, Aurora is the goddess of the dawn. So you think about links between the dawn and gold and things like that. Now, in ancient Chinese texts, gold was recognized to bring longevity, and with an important book of Tao, it's also recommended to be ingested to bring long life. Okay, so Tao is a religious belief, and basically they believe that if you were to ingest gold, it would lead to long life. And that's from ancient Chinese texts. As well as that, the Aztecs were also known to use gold from a healthcare application. So they actually use it as an implant, so in terms of dental inlays. So, we've got a bit of the use of gold in ancient times as well, but we're going to talk about now its use in modern medicine. Now, just before I talk about the use of gold in modern medicine, I'm just going to talk a bit about arthritis. So arthritis is the condition that auranopin, which is the drug molecule that contains gold, is used to treat. Now, arthritis, what is it? It's a condition that causes inflammation around the joints, okay? Now, because of this inflammation, it leads to difficulty in mobility, so moving around, and just pain in general. Now, there are different types of arthritis. One type of arthritis is rheumatoid arthritis, and that is actually an autoimmune disease. It's when the body attacks itself. Now, mistakenly, during rheumatoid arthritis, the immune system attacks tissue that lines the joints, and that then leads to inflammation. So here I've got a little diagram for you. So what's happening is this tissue is being and it's due to inflammation of the tissue. It's got swollen, inflamed synovial membrane. And here's the stages. So you've got the attack happening. Now the body makes antibodies. The joints start swelling up, and what ends up happening is the joints become bent, deformed, and it can be to a point in extreme cases where there's no joint remaining at all, and the joint is essentially fused. So you haven't got a joint, you've just got the bones fusing together, which really, really tough, can lead to massive issues. So it is a condition that is quite common, unfortunately. But what we're going to do now is we're just going to talk about how Oranophen, which is a gold-containing drug, can help relieve the symptoms of that. Now, this is Oranophen. I feel a bit at home now. I've got a bit of an organic molecule here with me. And we can see the gold here. Okay, so we can see the gold, and it's attached to sulfur. So sulfur is attached to it, as well as a phosphine ligand. Now, in 1890, so this was prior to the discovery of Oranophen and its use in arthritis healthcare, Robert Koch discovered that gold was effective in killing TB bacteria, and that was actually the first clinical use of gold. Okay, and him and Louis Pasteur, they're credited to be the fathers of microbiology and looking at immunology, things like that. Now, Oranophen, it's a modern day treatment used for arthritis. Okay, so this molecule here, it's used to treat arthritis. And well, how does it work? Now, it prevents a reaction called the peroxidization of unsaturated fatty acids. And I've got on the following slide a diagram to help explain this. Now, this reaction, this peroxidization, which Oranophen is preventing, this is linked to the inflammation. So if you're using Oranophen and you're preventing this chemical reaction called peroxidization, you're therefore preventing the inflammation. And by preventing the inflammation, you're actually relieving the symptoms of rheumatoid arthritis. Okay. Now I talk about peroxidization. This is what I mean. Okay. So those of you who are my year 12 students, you should recognize some radicals here. Here is your unsaturated lipid. So you've got your double bond here. And what happens is during your initiation state, you've got an OH radical, and you end up forming a radical there. Now, what you have is oxygen coming in, and you've got your oxygen coming in there, and you've got your lipid peroxide radical. So it's a radical reaction. You form this, and eventually what happens is you've got a lipid peroxide. Okay, now this reaction here, this is linked to the swelling of the joints. Okay, so the inflammation. Now, in terms of how Oranophen works, is it has a particular affinity. So affinity meaning in terms of electron affinity, things like that. Particular I think what's the word I'm looking for? I think affinity is the right word, really. Particular fondness, chemical fondness, for sulfur and phosphine and phosphor. So this is phosphine, but sulfur and phosphor. And basically, to do this peroxidation, you need enzymes. Now, what the gold does is, because it has a particular affinity, especially for this sulfur, it will bind to cysteine. Okay, so if you think about the enzyme, how an enzyme works, you've got the active site. Now, within the active site, obviously, you've got your amino acid side chains, and cysteine, and it's got a sulfur side chain, a sulfur-containing side chain, and this Oranophen molecule, it will bind to that sulfur. Now, when it binds that sulfur, obviously, you're in effect you're changing that, modifying, that's what I'm looking for, modifying the enzyme. And by modifying the enzyme, it can't do its job properly. So what you've done basically is you've modified the enzyme that does this reaction. And because you've done that, that therefore means that this reaction can't really happen. And because of that, you've actually prevented that inflammation there, relieved the symptoms of that arthritis. Just to conclude though, so that was actually those three metals that I really wanted to talk to you about this evening. Throughout history, metals have had a profound impact on healthcare, and are notably due to the antimicrobial and metals, their inert properties. And I really want you to appreciate that, we may have a view of, ancient times, they didn't really know anything, in terms they didn't have the same analytical techniques we do, the same technology, etc. So many amazing medical advancements were made during ancient times, if you think about it, with lack of technology, with lack of internet, things like that. And, I think it's something that should be celebrated. And there's so much that has been done by ancient times that we're still using to this day. Now, modern techniques have allowed us to develop these drug molecules that utilize these properties. So talking about antimicrobial properties, talking about inert properties, thinking about implants, things like that, alongside other properties as well, such as affinity for certain ligands, and that came up, we talked about oranophine, and also variable oxidation states, okay? So, cisplatin, the platinum, it needs to have a variable oxidation state for those ligand substitution reactions to occur. And I just wanted to, I ended up with that. I just wanted to go into, where next. So we've talked about certain molecules, but, research, it's continuing. When I was at university, I spoke to you earlier about my research in antibiotic resistance in Salmonella. So the way that I was at University of Birmingham, the way that our labs worked is quite open plan. My research group was one side, and the other side of the fume cupboards, it was Dr. Romero Canlon's research group, and she a few people on my course were actually on her research group doing master's projects, and she actually was looking at osmium complexes. Now we call these piano stool complexes because of this aromatic group here, which kind of sits at the top, a bit like a piano stool, it looks like. Now these have been developed to target cancer cells, and in particular cancer cells where they have become platinum resistant. So platinum resistant cancer basically means that you've used platinum complexes to treat it once because platinum is super successful. However, what has happened is that you've used that platinum within a certain time frame, the cancer has, come back. Now, if you think about ovarian cancer, if we say it's platinum resistant ovarian cancer, the time frame they give is 6 months. So this is kind of working around that. Now, these molecules here, so with this kind of structure, what they do and how they work is when they get into the cancer cells, they generate reactive oxygen species, so ROS. We can refer to as ROS species. And basically, when they're generated, cancer cells actually quite like these species. However, when the levels get too high, what can happen is cell cycle arrest. So it can stop one certain part of the cell cycle, which can prevent replication, and then also apoptosis, so cell death. Okay, so in terms of modern research and what it's telling you, it's actually really interesting because we're still to this day looking at how can we use metals to treat illnesses that were previously, organic molecules might not do the job as well. So that is basically it from me. I'd just like to take time now to ask if there are any questions that you've got about anything that I've talked about, or yeah, I'm happy. I'm open to questions now.
Okay, thank you very much. It's absolutely fascinating. Now, I'll start the ball rolling, I think, with some questions. And you answered one of my questions, which was what you anticipate the next advancement to be in metals in medicine. But perhaps you'd like to elaborate on that one. Where do you think we're going, metals in medicine?
I think in terms of modern scientific discoveries and research and things like that, I think the future is bright. There are so many people in science that are absolutely, I think I'm a nerd when it comes to chemistry and things like that, they're obsessed with it. Their life's purpose is to, treat these illnesses whilst doing their passion. And, I think the future is very bright. Like I said, there's work going on osmium. There's also, I think, iridium. There's work going on using iridium as well. So, looking towards a certain side of the periodic table. And, things like, that we currently got like carbon, so we've currently got like silver nanoparticles, things like that. I think they can always be developed, looking at certain different applications. So when I was at university, I was in Dr. Jones, or Alan Jones's research group, and my lab partner Vicky is one of my best friends as well. She was actually doing work not on metals, but she was actually looking at how antipsychotic drugs can be used to treat cancer. So existing drugs, but looking at how they can have a completely different application. And I don't see why we can't have that same story with metals as well. Existing drugs for different applications. It's all about the research, really.
Brilliant. Now, I'm conscious this is a webinar, and therefore Q&A is actually online, and I've put a little welcome in there. So if you've got any questions, can you please type them in for us? And so Miss Kaval and I can actually see what questions you have. I've got a couple more questions actually, but I'm not going to ask them. I'd rather the students ask them, please. Has anybody got any questions?
I can definitely see a few of my students, and they were telling me today, Miss, we're gonna have some questions ready for you to ask, so I'm waiting.
Come on then, students. If you haven't got any, I'm going to have to ask some more, aren't I? And actually, I shouldn't be the one that's asking them. This is designed to make you think and actually extend your brains a bit. Okay, while we're waiting then, I've got another question for you, actually.
Fantastic.
Right. Okay. Well, a couple of things really, but I'll just ask this question. What's your favourite metal application in medicine?
I would say, that's a tough question. I would actually say one that I haven't talked about today, which goes against actually that, you know, should talk about most interesting ones. I think I've talked about the most interesting ones. However, there is one that it's basically using mercury amalgams in teeth fillings, and the only reason I think it's so interesting is, you know, mercury. If you think about mercury, you think, you know, thermometers and bad for you, so you wouldn't think, you know, putting it in your mouth is the best thing, but you know, when it's part of this amalgam, this mixture, it, you know, it's able to do its job and work in filling. So I think that's quite interesting. In terms of the ones that I did today, I definitely think the anti-cancer drugs, I think there is so much capacity to develop them further. There's so much research being done on it, and it's just a really exciting field.
Okay, thank you. And we still don't have any questions. Let me just see. Well, I will ask one more then, and I'm sorry to hog. Oh, wait a minute. Right, and the chat is turned off. Oh dear, Fatima has sent me an email or a text saying that the chat is turned off. It shouldn't be. Well, if the chat is turned off, you should be looking at the Q&A, Fatima. It's the Q&A that you should be typing into, not the chat. We're not having chats. It's a webinar. Can anybody? Right, it's not in the chat actually. It's not on the icon of the chat. It's on the icon of the Q&A. Okay. So if anybody can see my post, welcome all. Please ask your questions here. The tab has just appeared to her. Okay. Hopefully, Fatima, you've got a question, have you? Let's hope so. There should be a tab on the top of your screens and you've got chat in there, but we have turned the chat off because in my experience, when we have lectures like this, people start talking to each other, which is good. But if it's not about the lecture, we don't want it. There is a Q&A with a question mark on it on the top tabs. And so if anybody has a question, can you start typing it into the Q&A? Let's have a look. Obviously, I'm not going to push anybody to ask a question, but it would be very nice if we had some questions, Ms. Kavals, from students, wouldn't it?
Yes, definitely. I think I can see some here actually.
Brilliant.
So let's have a look. Liam. So Liam's one of my students. Do the lanthanides and actinides have any medicinal uses? Yes, they do. Really common use actually is outside of medicine. Europium. I believe europium is used in Euro notes, I think. It's basically because it emits light, that's the application, but it's actually in terms of their medicinal uses, yes, they're used in imaging. So gadolinium is a contrast agent. So it is used in, you know, and that's the application of it. If I'm honest with you, off the top of my head, I don't know if they've got any use in terms of actual medicinal drugs, but I know for a fact that gadolinium, which does come into that group, does have a use in terms of medical imaging. So we've got a question here from Catherine, again, another one of my students. How is cisplatin able to target sections of DNA that are responsible for reproduction, or do they inhibit many sections of DNA? Basically, Catherine, the way it works, it just binds to the DNA, and if you've got it bound to the DNA, it's just going to prevent the replication. So that DNA is going to be important for that drug molecule, and the important for that cancer cell. And because you've disrupted that replication, it's just going to have an effect on it. So that's how you're going to cure those cancer cells. I think there's a few more.
Excellent.
Do we know if metals are used in veterinary medicine? I'll be honest with you, Miss Jordan, I've got no idea. If I'm completely honest, in terms of veterinary, I would assume so. You know, if they can be used in humans, you know, obviously there is the fact that what can be suitable for a animal might not be necessarily be suitable for a human, you know, and vice versa as well. I mean, I can think of thalidomide off the top of my head, that thalidomide, it wasn't useful, you know, it might have worked really well in rats, but it wasn't necessarily so useful in humans, definitely. But if I'm honest with you, I'm not too sure about the answer to that. But using my chemical head, I would assume so. One thing I would say is though that metals, they can be fairly expensive, so cost can be a factor, when factoring it in drugs to be used, and we're looking at pets and pet insurance and veterinary medicine, things like that. So I think cost might be a factor there. Here we go. So, question from Fatima: do metals have any major disadvantages when being used for medicine in the human body? Are there any negative side effects of using metals such as cisplatin? Cisplatin itself has really negative side effects. It's basically really potent. When we use cisplatin, it leads to really bad side effects, and that's why carboplatin was used as an alternative. It's not as effective, so it's a combination therapy drug. You would use it with other cancer treatments as well to target the cancer. However, if you think about it though, they both contain platinum, so I would say, taking an educated opinion on that, I think, yes, there probably are disadvantages. If we think about, Galena, which is used as eyeliner, yes, it probably did affect eye infections and really help them. But equally, I do want to put lead sulfide in our eyes. There are adverse effects to it as well. So, I would say there are often adverse effects. But when you've got the drug design process, you have to take that into account. So, off the top of my head, if I think about things like HIV, the HIV drug development process was actually really short compared to other drugs, and that's because it became such a problem, and it was affecting young men basically, and they thought, young men otherwise healthy are dying from HIV, we need to get a drug into market ASAP. Now, HIV medication, it does the job in terms of like it can treat it. However, and if you use it as a preventive measure, I believe there is medication that you can take. Obviously, I'm not a doctor, but from my own knowledge, that there is medication you can take within the first 72 hours that can prevent you getting it. It's really rough on your body, and but equally it does the job. So there's always going to be a little bit of I feel like there are very, very few drugs that have absolutely no side effects, and it's thinking about, okay, balancing the effect of the drug, the amount of money it costs, which is actually really important. We might not, personal point of view, money might not be that important, but also, if you think about manufacturers, NHS purchasing it, they do have to think about costings. So I hope that answers your question. So balancing loads of things, basically. Does the metal need to be internally used? Can it be administered externally to the body in the form of a copper bracelet from a non-science specialist? I think when we think about, so for example, dressings, we're thinking about the skin, aren't we? So we think about the surface of it. So it depends on the application. If it's something that's inside your body, for example, iron can be used in breast cancer drugs, you have to go inside your body to target that specific area. So I think it's just to do with the area that you're targeting. In terms of copper bracelets, I don't think the copper would actually, if you wore a copper bracelet and you were hoping to treat something that was, within your body, I don't think that would perhaps be the best option. If you think of a copper drug, it should be taken, within the body. But equally, if you've got things like, I know ointments, for example, they contain silver in them, silver nanoparticles. So, that's because it's to do with the skin. So it's all to do with the application of it. Why is mercury used in dentistry for fillings? For example, what qualities does it possess to make it the best choice? I'll be honest with you. The only reason I said mercury in dentistry, because I remember being in a lecture series at the time when I was at university, and it just absolutely blew my mind. And if I think back to why mercury is used, what we did was we looked at using mercury against something else, and I can't remember off the top of my head what we looked at comparing it against, and there were properties of mercury that would have made it a better option for fillings, compared to other materials. I think, if I'm off the top of my head, cost, I think. And also, the fact that we can use mercury amalgam, so it's not pure mercury, it's mixed with other substances. The reason that we can use these mercury amalgams is, it is safe to use. So, that is a benefit, and, I'm assuming that they are fairly strong and things like that. So, they does fit the purpose, and in that case, there aren't the toxicity issues which you would normally associate with mercury. Do metals greatly increase the cost of medical care, and is it normally part of the standard treatment offered by the NHS? So is it affordable for the general public? That's a really good question. I think I would like to think, you know, when we think about using drug molecules, and I've mentioned cost a lot, you know, for a scientist, but it is actually to do with cost. And I think, you know, if you've got certain cancers or certain illnesses that would, you know, for example, prostate cancer, cisplatin is the go-to treatment for it. That's why metals are used, you know, because for that case, cisplatin is the best possible option. And I think it's all to do with the fact of, you know, balancing the best possible option with the cost available to it. I mean, for example, teeth fillings, I'm sure gold is an excellent example for things that can be used for a dental inlay. You know, it's inert, it's strong, things like that. However, if there's a cheaper option that does the job, you know, just as well, or maybe perhaps not as well, but does the job anyway, I'm sure that would be, you know, preferred treatment, because, you know, there is that cost associated with it. So I think it's to do with balance. I think obviously I don't work in the NHS, I'm not sure how their costings work. In an ideal world, we would, you know, have access to the drug molecules regardless of cost. That would help us get better. Unfortunately though, we don't live in an ideal world, and, you know, there are loads of considerations to be making that are made by those NHS bosses. You know, a lot of it is to do with costings and things like that. Which metal is most commonly I would say probably platinum. In terms of anti-cancer drugs, platinum anti-cancer drugs are definitely the ones that are most common. There have been loads of, so I know in my talk I went through like carboplatin, oxaliplatin, but there are loads of platinum analogues that have been developed by companies, not as effective as cisplatin, but they are still effective cancer treatments to a certain extent. So in terms of, it would depend on the application. I'd say cancer, probably platinum. For, you know, if you think about hip replacements, we're talking about titanium, things like that. So depending on the application, but if I was to think about most common and the one that people would refer to in terms of drug molecules, it probably would be platinum. Any more questions?
Any more questions, guys? Well, that was, I have to say, a very profitable collection of questions, actually. An incredibly interesting talk. Lots of things to think about. And if anybody's the other side of this, thinking about personal statements, thinking about university applications, wow, there's such a lot to get at here, and some really interesting avenues to explore. And thank you so much for your amazing enthusiasm. I don't think I've seen an organic chemist this enthusiastic. It's wonderful. Please, I'd like you to indicate with your hands a thank you to Miss Kavals. I will be sending the link out to this, but also we are setting up a YouTube channel for the Oxbridge Network, and all the lectures will actually be going on to this. So there will be 2 lectures very soon on the YouTube channel, and I will be sending out a link to that as well. And then obviously Mr. Rory Salt is actually going to be doing the next one. And then we've got Dr. Stuart Hart doing the one after that. And Dr. Chris is doing his final one for this term. But as I said, next half term, we're actually going to have a lecture on fractals as well, mathematical fractals, which you will be invited to too. So this is designed to open your minds and get you thinking about things you'd never thought of before. And I have to say, I was very interested in the ancient history bits as well, Herodotus and the Egyptians and everything. So thank you so much. I hope you enjoyed it as much as we did.
Oh, definitely.
And we will be in touch and hopefully meeting again on the 9th of March for the next one. And if anybody's got anything they'd like to ask in the future, or they want to know anything further about the Oxbridge Network, then please contact your Oxbridge coordinator. And in the absence of them, just send me a message and we will get hold of that. And please do apply for the Oxbridge Network Essay Prize. There's money involved, but it's also a really good exercise of research, and it shouldn't be a chore actually if you're really interested in what you want to do. So details of that will be with your Oxbridge Network coordinator. Okay, thank you very much. Thank you once again. And you've had a standing ovation. Thank you.
Oh, thank you. And equally, if anyone would like any more information about metals, medicine, things like that, you can get my details from Dr. Foster. Please feel free to drop me an email. You don't have to be one of my students. You can go to being a student from another school if you might be interested in it. You've got my school email. You can get it from Dr. Foster. Please drop me an email. I'm more than happy to have a personal statements, things like that. Yeah.
Brilliant. Thanks very much. And I'll be in touch about the tutorial event, Miss Kavals.
Thank you. Take care.
You.
Bye.
Bye.